Hello, I'm Velda Ford, and welcome to another COVID conversation for October 18th, 2020. As you know, the coronavirus has been something that coronavirus is not our friend. And let me give you some information that will show you a bit about what's going on with the coronavirus. These numbers are as of October 5th, 17th, 2020. So as you can see, the total number of cases are going up. And this is something that we don't want to see at this time of year. This is the time where flu season comes in, where we don't have the ability to be outside, where more activities are indoors. It may be too cold to have the windows open, any number of things that increase the possibility that we will have the unfortunate effect of getting the coronavirus. The coronavirus typically starts out by infecting the lungs, the airways. Pneumonia is a side effect, and many people never truly recover from that. They end up tired, they have fatigue, they have issues with their heart, with their kidneys. There are multiple body systems that end up affected with this. And there are many people who have what is called long hauler syndrome, where 6, 7 months later, they're still having problems with smell and taste or energy, brain fog, confusion. And unfortunately, many doctors are not yet comfortable with this. So if you go to the doctor and you say, I have never really felt better, or I felt well and now I don't feel well again, they may not recognize this as part of a viral syndrome. If you know yourself, feel comfortable in saying, I need some help. So you see the total number of cases have gone up. Tests have been back and forth, and I don't use the testing numbers as too much to think about because sometimes people do a lot of tests, sometimes they don't. It's how much we have, how many resources, but with the testing, if we have more testing, we can have a better idea of what's going on in the community. Now, here's something that's really, really, really important, and that's the number of people who are currently hospitalized. Imagine this number where on the 13th of September, there were 918 people in the hospital. And now at this time on the 16th, we have 1,140 people hospitalized. The important thing about these hospitalization numbers is there's a lag. So if today you are exposed to someone who is infected, then it may be many days before you start to feel any effects of that, 2 to 10 days. Then once you start to feel the effects, there may be another 5 to 10 days before you are sick enough to need to be hospitalized. I sincerely hope that if you have any symptoms, you don't end up with a need to be hospitalized. Then if you are hospitalized, then you may end up in the intensive care unit and on a ventilator. Unfortunately, many people who go on a ventilator do not survive, or they have such severe illness that they stay sick and relatively disabled for a long time afterwards. You can look at this map to kind of see what's going on. And here we are in the triad, Guilford County. We have 10,000 cases total. Randolph County, 3,433. Alamance, 4,757. And then Forsyth, 8,049. So pay attention to where you are and understand that we have a lot more cases than we should have here. But if we're looking at, you can go to this site, which is Department of Health and Human Services, NCDHHS, and you can look by county what's going on and what deaths. So we're looking at Guilford County. We had 10,357 cases as of the 17th, 192 deaths. We have had a higher death ratio to cases than a lot of other counties. Part of it may be because of the number of long-term care facilities, or we're just starting to get a little lazy. So remember, hospitalization is something kind of scary. We are going in the wrong direction. Look at these cases. We are going in the wrong direction. And this is particularly important for people of color African American people because we're more likely to have those comorbid conditions, diabetes, hypertension, kidney disease, heart disease, all those things that if you already have an inflamed body, meaning your body is already trying to struggle to keep something straight, now this virus creates the problem. And remember, it's not the virus itself that hurts you, it is the body's response to the virus. So when the body is setting up a defense to do this, it kind of goes too far and it overwhelms the very systems that is trying to help. The most important thing you can do is not get this virus. How do you do that? You wash your hands, wash your hands, wash your hands. Especially if you've touched a surface, if you've been out and about, wash your hands. Use hand sanitizer of at least 60% alcohol. Then what else? Wait 6 feet apart. I know we want to get close to each other. We want to elbow bump. We want to give a hug. Don't do it. Don't do it. We've seen just from looking at the White House and what went on in the Rose Garden, all those people who were talking to each other, even though they were outside, there were like more than 24 people who became infected from that event. And now we're having a lot of super spreader events. It is smart and safe and macho, whatever excuse you need, to take care of yourself and consider that every person you're around has the virus. They may not, but if you treat them like they have the virus, maybe you won't have to treat yourself because you have the virus. The coronavirus is no joke. It's going to be with us for a while. Even with a vaccine, it will take a while to get everyone immunized. So be the person who's never had it. I'm Velda Ford. Remember that Jesus loves us and he teaches us that we should take care of those who have less than us, who are weaker than we are, and you can do that same thing. Remember to keep God in your heart and to be a discerning person about this disorder and everything in your life. This has been our COVID conversation for October 18th. Thank you, and I look forward to the moment when we can get a chance to see each other again, to just hang out together and enjoy being a part of the Maranatha family.